Immunology Question 4. 24. Tapson is prescribed for a client with acute immunodeficiency syndrome. For the treatment of toxoplasmosis, the nurse reinforces the medication instructions and tell the clients to 1. Discontinue the medication if nausea and vomiting develop. 2. Plan to take the medication every 6 hours around the clock. 3. Contact the physician if fever or sore throat occurs. 4. Report to the clinic weekly for the injections. The correct answer is 3. Contact the physician if fever or sore throat occurs. 25. Tetanus toxoid is prescribed for a client who sustained a foot laceration from a piece of metal while walking barefoot on the beach. The nurse prepares the injection knowing that the prescribed toxin is which of the following? 1. A toxin produced bacteria that has been altered so that is no longer toxic. 2. An attenuated bacteria. 3. A non-attenuated virus. 4. A specific antibody that will prevent infection. The correct answer is 1. A toxin produced by bacteria that has been altered so that is no longer toxic. 26. A nurse is caring for the client with acute immunodeficiency syndrome who is experiencing night fever and night sweats. Which of the following nursing intervention would be the least helpful is managing these symptoms? 1. Keep a change of bed linens nearby in case they are needed. 2. Administer an antipyretic after the client speaks of fever. 3. Make sure the pillow has plastic cover. 4. Keep liquid at bedsides. The correct answer is 2. Administer an antipyretic after the client speaks of the fever. 27. A client exposed to human immunodeficiency virus approximately 3 months ago has seroconverted into HIV positive status. The nurse anticipates that the client will experience which of the following at this time? 1. Oral lesions. 2. Purple skin lesions. 3. Chronic cough. 4. No signs and symptoms. The correct answer is 4. No signs and symptoms. 28. The home care nurse is ordering dressing supplies for a client who has an allergy to latex. The nurse asks the medical supply personnel to deliver which of the following? 1. Adhesive bandage. 2. Band-aid dressing. 3. Cotton pads and silk tap. 4. Brown bandages. The correct answer is 3. Cotton pads and silk tap. 29. A nurse is planning care for a client with an immune disorder. The nurse plans care knowing that the immune system consists of specific major types of cells. The nurse understands that which of the following types of cells is not component of the immune system. 1. B lymphocytes. 2. Helper T lymphocytes. 3. Dendritic cells. 4. Red blood cells. The correct answer is 4. Red blood cells. 30. A client with acute immunodeficiency syndrome has a respiratory infection from pneumocystis is evaluating the documented plan of care for the nursing diagnosis impaired. Gas exchange, which of the following would not be considered by the nurse to be post outcome for this client? 1. Is free complaints of shortness of breath. 2. Expectorates secretion easily. 3. Has clear breath sounds. 4. Limits fluid intake. The correct answer is 4. Limit fluid intake.